Hello, Mr. Jones. I'd like to explain some basics of hypertension or high blood pressure, which is another term, with you today. High blood pressure is like the pressure of water flowing through a garden hose. If the water pressure is too high, it can damage the hose or cause it to leak. Similarly, if the blood pressure in your body is too high, it can damage your blood vessels and organs. Primary hypertension is also known as essential hypertension. It is like a garden hose where the pressure is high for no good reason. In most cases, doctors don't know exactly what causes primary hypertension, but it tends to develop over many years. It's like slowly turning up the water valve on that garden hose without realizing it. Factors that can contribute to this include your genes, the environment, and your lifestyle, such as diet, physical activity, and whether you smoke or drink alcohol. Secondary hypertension is when high blood pressure in the garden hose, your blood vessels, is caused by something specific. This could be another medical condition that affects the kidneys, arteries, heart, or endocrine system. Think of it as something clogging the hose or pinching it, which makes the pressure build up behind that point. Once you find and fix the clog or the pinch, the underlying condition, the water pressure, your blood pressure, often goes back to normal. Complicated hypertension is like having water pressure in your garden hose for a long time, so much that it starts to cause damage to the hose itself and even the sprinkler or the nozzle at the end. In the body, this would be your organs like the heart, kidney, brain, and eyes. The damage can make high pressure problems even worse, and it can lead to serious health issues such as heart attacks, strokes, kidney failure, or loss of vision. So in summary, primary hypertension is high blood pressure with no identifiable cause building up over time. Secondary hypertension is high blood pressure caused by another disease or condition. Complicated hypertension is when high blood pressure causes damage to the body's organs. In any case, it's important to monitor your blood pressure and manage it, whether through lifestyle changes or medication, to prevent complications and maintain good health. There are some things we need to discuss involving your personal history and what you've been feeling lately, like the shortness of breath when climbing the stairs, are really important for us to look at. First off, it runs in your family, with both your parents having hypertension and your mom also having diabetes. That means you have a higher chance of having these conditions. Sometimes our bodies work in ways that are similar to our parents. You told me that you enjoy a few beers every evening and that you are not watching what you eat, especially salt, fat, and sugar intake. I know it is tough, especially with your busy schedule as a police officer, but these things could push your blood pressure even higher. Your job is stressful, and working in a high crime area doesn't make it any easier. Stress can also make your blood pressure go up. It is like when you're on high alert, your body is too, and that includes your blood pressure. You put on some weight this past year. 20 pounds is quite a bit. Extra weight can make your heart work harder to get all the blood to all the parts of your body, which can increase your blood pressure. Now, about the shortness of breath you feel when you're active, like climbing the stairs. That's your heart telling you it's working too hard. It's a warning sign that we shouldn't ignore. So all of these things, your family history, the food and drink habits, the stress from work, the weight gain, and the breathing trouble, they're all pieces of the puzzle that show us that your blood pressure is something that we need to get under control. Mr. Jones, one common complication of high blood pressure is left ventricular hypertrophy, which can eventually lead to heart failure if not addressed. Think of your heart like a pump and your blood vessels like pipes. When the pressures in those pipes are too high, like with your high blood pressure, your heart must work harder to push the blood through. Over time, just like how a muscle gets bigger when you lift weights, the wall of your heart can get thicker too. This is called left ventricular hypertrophy, and it's not the kind of muscle gain we want because it makes your heart less efficient, and eventually leads to serious problems like heart failure. Another way this occurs is that the wall of your heart's left chamber gets thicker in response to having to pump against high pressure day in and day out. This can make the space inside the chamber smaller, so it holds less blood, and it can make your heart stiff, so it doesn't relax as well between beats. All of this means that your heart can't pump as well as it should. I know it can be overwhelming, but making some changes can help. We can start by reducing your salt intake by cutting back on processed foods and fast foods, as they often contain high levels of hidden salt. Read labels on the food you buy and choose low sodium options whenever possible. Increase the potassium-rich foods in your diet, like bananas, sweet potatoes, spinach, and avocados. The potassium will help counteract the effects of sodium on your blood pressure. Try to incorporate unprocessed whole foods like fruits, vegetables, whole grains, and lean proteins. These foods are naturally lower in sodium and unhealthy fats. Initiating exercise slowly into your routine with low-impact activities like walking, swimming, or cycling for at least 30 minutes most days of the week. Incorporating strength training exercises such as weightlifting or bodyweight exercises will improve your metabolism and overall cardiovascular health. Stress management is crucial with relaxation techniques that you can try, like deep breathing exercises, meditation, yoga, or spending time on hobbies that you enjoy. Let's try and work on identifying strategies for managing your workload and finding time for your relaxation and leisure activities. If you're open to reducing your alcohol intake, you can drink in moderation. The American Heart Association recommends a maximum of 1 to 2 drinks per day for men. It is important for you to have regular checkups and to monitor your blood pressure. You can work closely with your healthcare provider to track your progress and make necessary adjustments to your treatment plan. If your healthcare provider ends up prescribing you medication to help lower your blood pressure, you must take it as directed and not alter the dose or stop without consulting them first. I know it can be overwhelming, but making some changes can really help. Cutting back on beer, eating less salt, and getting a bit more exercise, even walking, can make a big difference. Let's work together to make a plan that fits your life and helps you feel better.